Two of the most prominent advocates for making a plan be available without prescription, Dr. Elizabeth Raymond and Dr. James Trussell, admitted in a medical journal article in 2007 that easy access does not reduce pregnancies or abortions, and they admitted as well that that statistic that was just mentioned, that it's effective up to 90%, is substantially overstated. It's not that effective. In fact, it's less effective than any other form of birth control. That's why we're not seeing a reduction in number of unintended pregnancies since the FDA made the original decision. But what it does do is encourage young women to rely on this high dose of hormones as a regular form of birth control. And there have been no studies done to find out what happens to women who use this high dose of hormones multiple times. Another thing to take into consideration is that a reason why the birth control pill requires medical oversight, and that's the low dose of the same drug, is because it can carry serious side effects, blood clot, heart attack, stroke, but also it allows an opportunity for a doctor to talk with the woman and to check her for sexually transmitted disease. Many of these diseases don't carry symptoms, and the only way that a woman's going to know that she has it is if a doctor checks. And so by removing the medical oversight, it's encouraging young women to not see a doctor, which means they could be at greater risk to their health for long-term consequences. The judge that ordered the FDA to do this based on false information, that it was more effective than it actually is, also said that he wants to take it further and make it available to even younger than 17 years old. Now, this goes back to the issue of defining deviancy down. Just because there may be some young people that don't have a good relationship with their parents doesn't mean that every family should be treated that way. This is an intrusion into a parent's ability to direct the medical well-being of their child. 17-year-old, 16, 15, 14-year-old still needs their parents' permission to go on a field trip, to get their ears pierced, in most states to go to a tanning booth. And here now we're saying, a judge is saying, that the FDA must allow young girls to get a high dose of hormones.